So as far as the AED that you guys have here at this location, you guys have this one, it's the Medtronic's AED. Okay, you saw in the film, you saw how it was operated in some cases. So inside here are all the important things that you need. It has that little care package that has a razor in here if you need a razor to shave a really, really hairy chest. Okay, light hair chest, you don't have to shave it. It has gauze pads in there so that if you have to wipe the chest dry, really sweaty chest or wet chest, whatever the case may be. It also has scissors so that you can cut off all the clothing on the chest, because you know you have to have a bare chest in order to put the pads on. And also it'll have an extra pair of electro pads. So you have one set typically as extra, and that's it. So let's say you have an instance where you bring the AED to a victim and you open it up and it says battery low. What would you do?
Use it.
Okay, a couple things. You would send somebody to go get another AED, like maybe if you have one upstairs or in another room, okay, if you have one available, okay? Otherwise, I'd still apply it and try to use it because you'll still have some shocks available. So that's important for you guys to know. So the other thing that we have in the case, you guys have a different CPR mask barrier, but if you ever come across one, it's called a pocket mask. These are really hard to use. So the one that you saw in the film is the one that you guys have, which is great. This has a nose here. It says nose. That's the part that goes over the nose. The one thing to remember about these type of masks is that you need to have a good seal all the way around it. Okay? So when you put it on, the nose goes here, and you want to make sure it doesn't hang over the chin so the air escapes out. So you want to make sure it's on the flesh. Okay? And then we have what we call the C. So the head tilt hand, when you head tilt it, you want this much of your hand to go over the mask so that you're going to be able to push down on that and have a good seal. And then when you lift up on the chin, this part of your thumb is going to push down on the rest of it. So when you do this, head tilt, chin lift, to give those breaths, you're going to have a really good seal. Okay? Because if you don't have a good seal, then why even do breaths? You know what I'm saying. Okay? So a couple of the ground rules when we begin doing breaking up into our groups to do the skills portion is, one, watch the people in front of you, okay? Because you're going to learn from them, because they might make mistakes, and hopefully you'll learn from their mistakes. Also, they might have some different scenarios than you. So this way, we don't have to do 5 different scenarios for one person. We'll just learn from the other people's scenarios. Second of all, questions that people ask are great. Okay, we encourage them, but wait till the scenario is over. And the reason being is interrupting scenarios throws us off, and sometimes we lose what we're doing at that point. So if you can kind of hold on to those questions and wait till the scenario is over. And also try to refrain from talking to each other, because especially in a room like this, it gets noisy. And again, it's hard to really focus on the task being done. Now I'm going to show you, any questions at this point?
I have a question.
Yes.
If the person was shot, or if he was burned and the clothing was stuck to his skin and all that, would that even work? AED?
Okay, good question. I've never had that question asked before. Okay, so if the clothing is on the victim,
Like
burned on the victim, okay, can you put electro pads over it? In that case, no. And you wouldn't want to be peeling the burnt clothing on somebody because it'll pull the flesh off with it. So, and we want to leave that for the professionals to deal with, okay, in a very sterile environment. So in that case, you might not be able to use an AED if the clothing is burned onto somebody. Yeah, but great question. I've never had that one before. All right, any other questions? Okay, so what we expect for you when we do the skills session is for you to do everything properly, okay? So when you're doing the CPR, I want to make sure that you're doing all the skills properly. When you're checking for breathing, I want to make sure you check it for 5 seconds. I don't want you to say, oh, not breathing, and start CPR, okay? When you attach the AED, I want to make sure the pads are in the right place and that everything is done properly there. So I'm going to show you what's expected of you, okay? All right, so we know the scene's safe. I want you to say that, scene safety. You approach, okay? The first thing we want to do is wake them up. So we're checking for unresponsiveness. Hey, actor, actor. Or it could be whoever you want. Hey, and I want to see you do this 3 to 5 seconds. Hey, unresponsive. Ricky, can you call 911, get the AED, and have John guide the first responders in?
All right, will do.
Now I'm gonna check for breathing. How long am I gonna check for breathing? At least 5 seconds. Not breathing. So I'm gonna bare the chest, put modesty aside, bare the chest, make sure your hands are in the right place, and I'm gonna do compressions. How fast are these compressions? 100 compressions per minute. How deep?
2 inches.
At least 2 inches.
I'm back with the AED for you.
Thank you. Immediately get the AED on this person because the first shock on board gives them the greatest risk of surviving. Turn it on, pull the pads out. You're going to rip open the, it'll tell you where.
Electrodes.
Okay, you're going to rip those open and you're going to grab the pads, which are inside the package. Connect to the machine. There's a picture right here that shows you exactly how that goes in. Your pad placement for you guys, one pad goes upper right, other pad goes lower left.
Connect electrodes.
Upper right goes above the nipple, below the collarbone. The other pad goes the side of the victim, below the nipple. And again, if you just look at the picture, place it exactly like you see, can't go wrong.
Connect electrodes.
Once you have the pads connected, the machine's going to automatically
Stand clear.
tell you to stand clear.
Analyzing
And
now.
it's going to analyze. So
Stand
tell you.
clear.
Everyone stand clear.
Shock advised.
Shock advised, everyone stand clear. It also has a display here that shows you, it says shock advised. So if you can't hear, at least you can see.
Stand clear. Push to shock.
All clear?
Clear.
And there's a button. All clear. You'll see a muscle.
CPR.
You'll see a muscle contraction and it says start CPR, so I'm going to start CPR. And I'm going to begin CPR. How long am I going to do this for?
30 compressions.
Okay, for 2 minutes. So I'm going to do 30 compressions. I just finished 30 compressions. What do I do next?
2 breaths.
2 full breaths. So I'll open up the airway, give 2 full breaths. How? Then what?
More compression.
30 compressions, 2 full breaths. How long do we do that for?
2 minutes.
2 minutes. And after 2 minutes, what will happen?
Analyzing.
Stand
The
clear.
machine will tell you to stand clear. Everyone all clear?
Analyzing now.
Stand clear.
Clear.
I want to hear you say that. Stand clear.
No shock advised.
No shock advised.
Start CPR.
Perfect. So why would no shock be advised?
Yeah, because the heart rhythm is different.
Because there might be a heart rhythm. Very likely at this point. Okay? Are we still doing CPR on someone that has a heart rhythm?
No,
Yeah, they told
They're
us
not
to start
breathing.
CPR. If we don't see any signs of life, then we're going to do CPR. If we do see signs of life, then we're going to stop and recheck breathing to make sure they're breathing. Just keep them laying down there. Keep the pads on. Don't ever take the pads off. When 911 gets on scene, they'll go ahead and take over, and they'll probably put on their own machine and evaluate. All right? Any questions? No? It's all good? Okay, perfect.